The ASHA Functional Assessment of Communication Skills was developed as a measure of the functional communicative status of people with acquired neurogenic communication disorders, such as aphasia and TBI. The assessment consists of 44 items which assess 4 domains of functional communication. Based on observation and communication with family members, a speech-language pathologist or family member rates each of these domains on a 7-point scale of communicative independence and a 5-point scale of qualitative dimensions of communication. Mean scores for each domain can be totaled and calculated for communicative independence and qualitative dimensions of communication. The assessment takes about 20 minutes to complete. In order for a speech-language pathologist or caregiver to complete the ASHA FACS, he should be familiar with the client's usual communication abilities based on prior observation. However, the client does not need to be present when the ASHA FACS is scored. The demographics section must be completed prior to scoring. Information such as client name, date of birth, reading and writing abilities, and employment information is included here. Site information and level of care are also specified in this section. Any use of hearing aids, glasses, and AAC devices should be noted in this part of the demographic section and should be properly functioning during SLP observation of the client's communicative abilities. On page 3, the highest level of education as well as diagnostic information are included. ICD-9 codes are listed in Appendix 3 of the manual and should be used on this portion of the demographics form to classify diagnoses. The scale of communication independence is a qualitative measure of the client's need for assistance and/or prompting by another person during communication. It is a 7-point rating scale describing a continuum of communicative independence. This measure does not penalize the client for alternative modalities of communication other than speaking. The definitions of the scores for this scale are listed here, and more descriptive examples can be found in the assessment manual. If a client shows variable performance on a specific item, assign the lowest of the scores being considered. If behaviors cannot be observed, assign N for no basis for rating. However, this should be used sparingly. If greater than 20% of the items in an assessment domain are skipped, that domain will be considered invalid according to scoring procedures. Examples of ways in which people assist or prompt their conversational partner are listed here. They include repeating, rephrasing, simplifying language, slowing rate of speech, providing help in using assistive or alternative devices, using gestures, writing or drawing pictures, giving additional time for responses, asking yes or no questions, giving a limited choice, repeating what the client said, and encouraging the client to augment communication with writing or gestures. Here is an example of the social communication domain scored on the scale of communication independence. Items pertinent to social communication are listed along the left side of the page. For each item, the number corresponding to the observed degree of communicative independence is circled on the scale displayed on the right side of the page. After this process has been completed for each of the 4 assessment domains, the total score, the total items rated, and the mean score must be listed in the appropriate boxes here. The mean score is calculated by dividing the total score by the total number of items rated, and these scores should be rounded to the nearest tenth. The example shown here is for the daily planning domain. Also be sure to fill out the information sources section of the assessment form to indicate who provided the information for scoring as shown at the bottom of this page. In order to complete the communication independence scores summary page, the total scores, total items rated, and mean scores must be transferred to the corresponding spaces here for each assessment domain. The mean scores for each domain are then totaled and entered in the corresponding cell. Then, enter the total number of domains rated. This will be 4 unless greater than 20% of items in any domain were not rated. To calculate the overall communication independence mean score, divide the total domain mean score by the total number of domains rated. Also be sure to complete the demographic information and evaluation type at the top of this page, and provide additional notes as needed in this section. To graph the profile of communication independence, the scorer must plot the domain mean score for each assessment domain in the appropriate column. Use the correct symbol according to the key provided to indicate whether the evaluation type was for admission, interim, discharge, or follow-up purposes. As shown in this example, repeated assessments are charted on the same graph as a measure of progress. After completing the scale of communication independence, the scale of qualitative dimensions is completed for each respective assessment domain. This scale adds descriptive information about the nature of the client's communication abilities. This may provide the underlying reason for his or her use of assistance and/or prompting. This section should be scored as these qualities would occur without assistance and/or prompting, and regardless of modality of communication. A space for qualitative dimensions of communication scores is provided after the end of each assessment domain, as shown here. The 4 qualities considered here are adequacy, appropriateness, promptness, and communication sharing. The 4 qualitative dimensions are rated on a 5-point scale, which designates the frequency of occurrence of these qualities during natural conversation, 5 being most frequently, and 1 being least frequently. In some domains, cells are shaded to indicate that the corresponding qualitative dimension is not applicable. For example, the communication dimension is shaded because it is not applicable to the reading, writing, and number concepts assessment domain. The definitions of the qualitative dimensions are as follows. More specific descriptions for each level of the 5-point scale are listed in the manual. These should be reread carefully before a score is assigned. Again, if the client shows inconsistent performance in one of these dimensions, assign the lower of the scores being considered. The qualitative dimension scores for each assessment domain are then transferred to the appropriate cells on the summary page. Total the columns to calculate the total dimension score for each communicative dimension. Under the total dimension scores, count the total number of domains rated. To calculate the dimension mean scores, the total dimension score must be divided by the total number of assessment domains rated for each dimension. These should also be rounded to the nearest tenth. The dimension mean scores are then totaled, and the total dimension mean score is written in the appropriate column. The total number of dimensions rated is listed, and the quotient of these two numbers yields the overall qualitative dimensions mean score. Also note the purpose of the evaluation and the demographic information in the top section. Gender and cultural differences, as well as any aspects of a dimension which are not deficient, should be described in the notes section of the summary page. To graph the profile of qualitative dimensions of communication, plot the dimension mean scores for each qualitative dimension. Use the correct symbol according to the key provided to indicate the evaluation type. As shown in this example, repeated assessments are charted on the same graph as a measure of progress. This concludes a summary of the procedure for administering and scoring the ASHA FACS. For more information, please refer to the manual as cited here.